Let's talk now to Dr. Dean Eggitt, our favourite GP. He's up in Doncaster, the local medical committee there. And of course, it is once again a January crisis for the NHS. The front page of the I newspaper this morning has got a story basically saying they've got new plans. Wes Streeting's got a new plan. A&E patients may be treated at home. I don't know how this is going to work, Dean. I don't know about you. I mean, they can't treat people in the A&E, never mind sending people to their house to treat them. How's that going to happen? Morning.
It's just good morning, Mike. It's a strange one, isn't it? Here we are again at this annual NHS crisis, and hospitals are full. We know that there are no beds, there are no staff there. So there's been this idea now, actually over the past couple of years, of this project called Hospital at Home, where instead of having a patient in a hospital bed, you leave them at home and staff go out and see them in the community. Right. So in theory, don't buy hospital beds anymore, keep patients at home and send staff out to them. I think that's the plan. But I've never heard the concept of treating people with accidents and emergencies at home. I'll be interested to see how that one works.
Well, exactly right. I mean, because the last information we were given was that if you do have an emergency, the best thing to do is to get yourself to the A&E. Don't call for an ambulance. Now they're going to say, actually, don't bother going to the A&E, just stay where you are. They're also talking about setting up respiratory hubs for chest infections and asthma. And all of this sounds great on paper, but the trouble is, at the end of the day, you need the people to do it. And that's what we keep being told we don't have.
You do, that's entirely right. So I think the government need to move away from talking about hospitals and hospital beds and start talking about staff and workforce, because we have these respiratory hubs already, but what we don't have is an increased number of doctors and nurses and people to staff it, just as you say, Mike. So whether the patient is at home, whether they're in a hub, whether they're in hospital, it's not just the bricks and mortar and beds that we need, it's actually staff to look after patients. And that's what we just don't have at the moment.
Yeah, exactly right. And let me ask you about this other story that popped up over the weekend. It's a study that's been done for the Centre for Social Justice, a think tank, where they say that 4 out of 5 GPs are worried that the stresses and strains of everyday life are being too readily labelled as mental disorders. And actually, they're just everyday stresses and strains for people that they've become less resilient about.
Yeah, it's a tricky story, this one, isn't it? Because depression, anxiety and other sorts of mental disorders or mental poor health actually do really come from life. Yeah. You know, it's not as though one day you wake up and suddenly the chemistry of your brain is abnormal, although that does happen. That's actually quite rare. Usually people with poor mental health is because of their socio-economic circumstances. Poor housing, poor income, being female, and being a young person, all of these things are known risk factors for poor mental health. So since COVID, the economy has taken a nosedive. The country is in freefall. Are we surprised that there are more people with poor mental health? Well, I'm certainly not. I guess the problem is, how do we treat it? Because giving you a pill is not going to change how much money you have in your household. It's not going to change your background. So what we really need to do is look to find out how we can improve people's mental health by improving society as a whole.
Yeah, but also we've seen an increase in people taking time off for stress, right? Which technically speaking would, I presume, come under the umbrella of mental health. I think we had a story in the Times a couple of weeks ago saying that I think a third of young people between the ages of 18 and 24 have taken time off with stress in the past 12 months. And I wonder if it's just because it's easier to do now than it used to be. I mean, when I was in my 20s, you wouldn't ring up the office and say, I'm suffering from stress. And I know that people will say, yeah, well, you're just an old dinosaur. Of course you wouldn't do that, but maybe that's why you're now mad. You know, but the point is that I just wouldn't do it. Whereas the culture now is that nobody bats an eyelid if somebody goes, oh, you know, I'm not feeling too good. I think I'll just have a duvet day. And in fact, I just don't think I'll come in Monday to Friday at all.
There's definitely a blend of that, isn't there? So there is this probably, I should say, healthier, I think, approach to work-life balance, where we're not going to kill ourselves to be at work anymore. And if we are unwell, we'll actually take the time off. We should probably celebrate that as a good thing. I think there are some people who will take that to an extreme, but largely we shouldn't kill ourselves to work. But at the same time, we have this constant drive for a growing economy. And over the years, work has just got harder and harder and harder. So what you can't have is people working at 100% all of the time, because they will collapse and fail. It's fine for us to put complete effort in for a week or two, but you can't do it all the time. So we have this unhealthy country where we're driving for economic growth, And we have a cohort of younger people now saying, well, actually, I'm not going to kill myself for work. Quite rightly so. But what we don't have is a solution to mix that. Younger people not wanting to kill themselves, but a workplace wanting to kill you for extreme growth. We need to have that as a genuine conversation. How can we grow as an economy without killing our young people?
Sure, but I mean, there is lots between killing yourself for work, working hard, and, you know, doing absolutely nothing and just staying in bed because you don't fancy getting up, you know?
Yeah, but I'd like to think that they're a minority of people. And let's be honest, they do exist. So there's a minority of people who don't want to work, don't want to contribute to the economy, and do just phone in and say, it's not for me, I'm going to take a duvet day. I'd like to think that they're a minority, and we should spend some time looking at those and trying to get them back to work. But we probably shouldn't, or we should not, label the rest of society who actually just have a terrible time with this economic growth. We can't just say that they're lazy, and we don't want to flog them. We want to look after them so that they stay strong, they stay healthy, and they continue to contribute to the economy.
Well,
but, you know,
many of them haven't. Yeah, well, that's the trouble. Many of them haven't contributed at all yet, and yet they want to be looked after by it, and that's the other problem. But we'll talk some more. Dr. Dean Eggitt, thank you very much indeed, GP and CEO of Doncaster's local medical committee.